Hello everyone, this is Bob Brenner. This is a YouTube version of the Inspire Medicine talk I gave August 19th at Nebraska Medical Association about improving the health of Nebraskans. And the title, Meh Isn't Good Enough for Nebraska Kids. Baxter, what do I mean meh? Well, one of my role models in life was a guy named Hans Rosling. He was a Swedish physician who was a missionary in Africa physician first part of his career. Then he went on, became a population health professor at the Karolinska Institute in Sweden, the same place as the award's Nobel Prizes. And he got world famous for his TED Talks in the early days of TEDs when his health statistics talk was actually one of the top 10 TED Talks for years. And he did such a good job of explaining to people how data can improve health and what it really meant, and also getting rid of some people's misconceptions about health across the world. He had a follow-up book that was an international bestseller called Factfulness, and one of the things he pointed out is that if you could only measure one thing about a population, it would be infant mortality. And why infant mortality? Well, because infants are the most vulnerable part of your population. If they're suffering, there's all kinds of things wrong in your health system. And so this is something we should focus on in Nebraska. Well, how are we in Nebraska? Well, unfortunately, we're kind of meh. Nebraska is about average for the country. Where the good news is we're better than, say, Alabama or Kansas, but we're worse than, say, Colorado, Iowa, or New Jersey. And this just isn't good. There is a Healthy People 2030 goal on reducing infant mortality for the country here in the next decade or so. And average for the country in 2019 was 5.6, pretty close to Nebraska. They've set it getting below 5, which is certainly improvement, but it's kind of meh. Meh isn't good enough for especially Nebraska's kids. I'm a competitive person. I want Nebraska to be better on this. And why do I say it's meh? Well, if we look at the rest of the world, they're far lower. Most of the developed world is in the 2 to 3 range. So their infant mortality in most of the world, compared to Nebraska, is a half to two-thirds lower. So these two countries, Japan and Ireland, at 1.8 and 3. Actually, I'm not pulling those up at random. I have a personal reason to look at those three countries, and the reason is that I have three daughters, and they live on three continents. One lives in Japan, one lives in Ireland, one lives here in the U.S. And the title I most want to aspire to next in life is Grandpa Bob, and selfishly, I'd like them to move closer to Nebraska. I'm a sixth generation. They're the seventh, and I'd like the eighth to grow up here. But maybe they shouldn't. And the one in the United States is actually in Colorado, which we showed earlier as a lower infant mortality. So it'd be safer for them to start families in another state than Nebraska, at least for that first year. And that we just shouldn't be that way. There are some state efforts to try to make this better. There's a group called Align that meets at the College of Public Health and tries to work with health systems to improve what we're measuring. We made a lot of progress in the last 5 years on cancer screenings and vaccinations in Nebraska, actually under insurance contracts. But the next thing we're going to focus on is prenatal and postpartum care, because we should, because of this problem, actually. There's ways we can do this. So one of those, improving access to prenatal care would likely make an improvement. There's also a Healthy People 2030 goal on that, and getting it below 80%, or getting more than 80% of women in for adequate and accurate prenatal care. And Nebraska has a problem there as well. If you look at our Medicaid population, you'll notice that most of the state for Medicaid is below that area. That shouldn't be a problem. We have presumptive eligibility in Nebraska, which means any woman who gets pregnant in Nebraska who does not have health insurance can get on Medicaid. So why is this still low? Well, there's a lot of reasons. There's barriers that some women don't know that they can get on care. The process of applying is difficult. This is something we can improve and should improve. It's not just access to prenatal care. Breastfeeding is another one. This is it's a busy slide, but there's a link to this in the notes section. This was a big study this year where they actually linked birth records to mortality records for infants, and found that just one exposure, meaning ever breastfed in a hospital, had a 26% reduction in odds of dying in the first year of life. So infant mortality can be made better by better breastfeeding, for example. And just the ever breastfeed kind of struck me. I was reading a Journal Star article earlier this year where they talked about this baby giraffe being born, and they were having trouble getting it to feed, and how it was important for that baby giraffe to have that colostrum, the mother's first milk, to kickstart its immune system. And it reminded me growing up, I grew up in western Nebraska. This is me, by the way, at the Cheyenne County Fair with my breeding heifer project for 4-H. We were taught the same thing for calves, that they needed to get that first breast milk from mom right away. But why have we forgot about that for women? Women are human babies. We need that as well. And in Nebraska, we could do better on breastfeeding at discharge. There's a huge variation, which means there's room to improve, of course. And you can look at these rates. I've got them at healthynebraska.org. We've got some public Tableau sites where you can look at a lot of maternity care measures and kind of see how Nebraska performs at the county and health district level. So we can make these things better, but Nebraska, we need to compete with the rest of the country for young folks, and we're not going to be able to compete with Colorado and their mountains, and we're not going to be able to compete with California on their beaches. But there are things Nebraska could compete on, and I think it's a good place to raise a family, but we also need it to make it be a place for us to raise healthy kids. And so we can complete on best place to raise a family in Nebraska, but we've got to start focusing on that first year of life and pregnancy so that we can be better place to have. So, our kids go off and explore the world. We want them to come back here and raise their kids, but we want it to be safe. So there's a lot of things we can do. We're working on some things in health system area. We're working on some projects. We'll hopefully be launching in Omaha, Lincoln, and Grand Island this coming year. For working with physicians, for example, physicians can talk to their patients about early access prenatal care and make sure women understand that they should get in that first 12 weeks for that first prenatal care. Get on started on their prenatal vitamins, get screened for things that could cause birth defects, get better nutrition, quit smoking, things like that. To do that, we need to help them get connected and covered. We have some insurance coverage issues in Nebraska that are confusing. It's hard to apply, even though we're a presumptive eligibility state, which means any woman with no health insurance is presumed eligible for Medicaid. Actually, the paperwork process is harder than you might think. We could fix this. This is a fixable thing. And we also need to advocate for and support breastfeeding as early as possible. Because we can make this better. Matt isn't good enough for Nebraska's kids, so hopefully in the next year you'll start seeing more about this, and hopefully you'll join with these projects and be supportive of this because we do need to make this the best place in the state country to raise families.